name is Ben Strino, and today we're going to do mobilization of the hip, knee, and ankle joints. Okay, so first I'm going to position my patient in a firm mattress or a table, and I'm going to position my patient in supine, and I'm going to tell my patient the procedure that I'm going to do and where I'm going to place my hands. So I'm going to tell him that I'm going to position my hands near the hip joint. And is that okay with you?
Yeah.
Okay, so I'm going to position the right hip, since this is the hip that's have limitation. I'm going to position it up to the range that the right hip can do. And then I'm going to position my hand near the hip joint as possible. And I'm going to distract the hip joint so I can assess the joint play. Is that okay?
Yeah.
Okay. So, just to say, I'm going to do a grade 1. Have any pain?
No.
And then I'm going to progress it to grade 2, which is a large amplitude to increase the range of motion. And then I'm going to assess the range of motion of the hip. Just relax and let me move it. And try to observe my patient's reaction. Do you have any pain?
No.
Okay. Alright, now I'm going to do an inferior glide of the hip joint to increase the abduction, because my patient have 50% limitation toward abduction. So first I'm going to assess the range of motion, and then I'm going to use a towel to position the hip. Are you comfortable?
Yeah.
Okay, so, and then actually, let me just cradle the leg, and then I'm going to do an inferior glide. Position my hands as near as the hip, as far as I can near the hip joint. And then I'm going to do an inferior glide to increase abduction. So right now I'm doing a grade 3, which is a large amplitude. To increase the range of motion. Is that okay?
Yeah.
Do you have any pain?
No.
Okay, and then I'm going to assess the range of motion. Okay. So next I'm going to do a posterior glide up the hip to increase the hip flexion. So what I'm going to do is I'm going to put the leg over my shoulder and position my hand as far as I can near the hip joint, and I'm going to do a posterior glide. So I'm doing a grade 2, a large amplitude in the mid-range. So if I want to progress it, I'm going to go for grade 3, which is a large amplitude too. And then I'm going to ask my patient, do you have any pain?
No.
Is it okay? Are you comfortable?
Yeah.
And then I'm going to observe and assess the range of motion. Okay. Now I'm going to do an anterior glide. So for anterior glide, I'm going to ask my patient to position in prone. Can you lie on your stomach?
Sure.
Okay. So I'm going to ask my patient if he has low back pain. Do you have any pain in your...
No.
Okay, so if he has, then I have to put a towel there to give a support. Next I'm gonna do is increase the hip extension of the right hip. So let's pretend this is the right hip. So what I'm gonna do is I'm gonna cradle this leg, and then I'm gonna position my hand over the proximal femur near the acetabular head, and then so I'm gonna push on this side, and then I'm gonna push to the restriction, and I'm gonna apply a small amplitude for grade 4. I'm gonna ask my patient, are you okay?
Yeah.
Do you have any pain?
No.
Okay. And then I'm gonna assess if there is an increased range of motion for the hip joint. Okay. So that's anterior glide of the hip joint. Okay. So next I'm gonna do is to increase the internal rotation of the hip joint. So what I'm going to do is I'm going to do a posterior glide, but I'm going to position the hip in a slight internal rotation. Just relax. Let me position your hip, and I'm going to place my hand near the hip joint, and I'm going to apply a grade 2 posterior glide while rotating it into internal rotation. So I'm going to do a large amplitude. I'm going to ask my patient, you okay?
Yeah.
Do you have any pain?
No.
Okay. And then I'm going to assess the range of motion. Is that okay?
Yeah.
I feel like there's a little bit of increase of movement.
Yeah.
Okay. So that's increasing the internal rotation. Okay, now let me do mobilization of the knee joint. First, I'm gonna position the knee in into slight flexion, and then I'm gonna do a posterior glide to increase the knee flexion. So I'm gonna do a grade 2 posterior glide, and I'm going to position my hand near the joint line. So I'm going to do a large amplitude. Are you okay?
Yeah.
Alright, so let me just stabilize the femur over here and do a posterior glide. So I'm giving a large amplitude mobilization. Is there any pain?
No.
Okay. Alright. And then I'm going to assess the range of motion. Is that alright?
Yeah.
Any discomfort?
No.
Alright. So that is posterior glide. Now I'm going to do an anterior glide to increase the knee extension. So I'm going to put a towel there, and I'm going to stabilize the femur, and then I'm going to apply an anterior glide on the tibia to increase the knee extension. So this is grade 3. I'm giving large amplitude mobilization. Is this alright?
Yeah.
Comfortable?
Yeah.
Okay. And then I'm gonna assess if there's any increase in range of motion. So that is grade 3 anterior glide. Okay. Now to increase the patellar mobility, since my patient have limitation let me put the towel under. Since my patient have limitation of patellar mobility to medial and inferior, so to increase it, I'm gonna do a patellofemoral mobilization. So first, I'm gonna test the mobility of the patella. And then I'm gonna do, since it has mobility on the medial, I'm gonna do a medial glide. So I'm gonna do a grade 2. It's a large amplitude. Let me just cup the patella. It's a large amplitude to mid-range. You okay?
Yeah.
Alright. And next, I could do, since he has limitation inferiorly, let me assess. So I'm gonna do a grade 4 mobilization of the patella. So inferior glide, I'm gonna assess the joint up to the restriction, and then I'm gonna apply inferior glide. So just a small amplitude for grade 4. Is that alright? Does it give you pain?
No.
Okay. Alright, and then to assess, I'm gonna move the joint, let me move it, and see the patellar tracking, patellar mobility if it's glide accordingly. Okay, so that is for the knee joint. So now I'm gonna do the ankle joint. Okay, so next will be the ankle joint. I'll have my patient lie supine in a firm mattress comfortably, and I'm gonna put a towel under the tibia, and I'm gonna ask, are you comfortable?
Yeah.
Okay, so first I'm gonna do a posterior glide of the talocrural joint to increase the dorsiflexion. So to do that, I'm gonna stabilize the tibia, and then I'm gonna move the talus posteriorly, and I'm gonna do a grade 1 since my patient had 6/10 pain. So I'm gonna do a grade 1, just a small amplitude in the beginning of range, just an oscillation. Is that okay?
Yeah.
You're comfortable?
Yeah.
Alright. So that's to increase dorsiflexion, and then I'm just gonna assess the range of motion if there's any increase. And the patient is relaxed. And then I'm gonna do an anterior glide to increase the plantar flexion. So I'm gonna stabilize again the tibia, and then I'm gonna do an anterior glide to increase the plantar flexion. So I'm gonna do an oscillation, a grade 1, because of the pain. So it's just a small amplitude in the beginning of the range. Is that alright?
Yeah.
Okay. So for increasing eversion of the foot, let's say this is the right foot. So to increase the inversion, I have to give a medial glides. For this one, I'm gonna do a grade 2 mobilization. So I'm gonna put towel here. And are you comfortable?
Yes.
Okay, so I'm gonna put gonna apply medial glide. Okay, medially. I'm gonna move your foot medially. So I'm gonna move the talus medially. Is that alright?
Yeah.
So I'm giving a large amplitude in the mid-range while stabilizing the distal tibia. so, and that one I did in prone position. And now for increasing the inversion, I will have my patient lie in side lying position. So this is it. Okay. The right foot. Alright, so I'm gonna support the right foot. Here. The right foot?
Yeah.
Okay. Alright. So to increase the inversion, I'm gonna do a lateral glide of the subtalar joint. So I'm gonna stabilize the tibia and I'm gonna apply a lateral glide in the talar area, in the talus. So I'm giving grade 2, large amplitude in the mid-range. Is that alright?
Yeah.
Are you comfortable?
Yes.
Okay. And then I'm gonna assess the range of motion. Is that alright?
Yeah.
You have any pain?
No.
Okay. So that's it for the hip, knee, and ankle joint mobilization.